Hello, my name is Lauren Thompson. This is my handler, Jane Bond, and my demonstration horse, Bonita. And I will be showing you tonight the different vital signs that we use to keep track of a horse's health. Now, the first thing that you want to examine when you're looking at a horse's health is their general attitude and appearance. Now, of course, this is something you're going to have to observe over time to get a sense of what's normal, and then contrast what's normal with what you see. I want to make sure that my horse is not looking depressed or agitated. Anything that is a sign of pain would be bad, so any kind of biting or ears pinned, looking aside, swishing tail, pawing, squinting eyes. I want to make sure that my horse appears healthy and then, of course, has a good attitude and doesn't seem to be in any kind of distress. Then for my vital signs, I'm going to start at the head and work my way back. The first vital sign I'm going to check is my mucous membranes. Now, the mucosa you can check either at the gums or in the conjunctiva of the eye. Generally, we don't check the conjunctiva of the eye because horses don't like it when you go poking around their eyes. However, if I wanted to, I could gently pull the eyelid down and examine the conjunctiva there. Now, what I'm looking for is for the mucous membranes to be pink and moist. So, to check the gums, I simply move the lip up and examine. And I can tell that they are moist and pink. If it's dry, that's bad because it means the horse may not be very hydrated or maybe having color-wise issues with circulation or shock. So if it's pale or bluish, the horse may be in shock. Purple may be a lack of circulation. Bright red could be fever or infection. And if they're yellow, that could mean jaundice or liver problems. Now, while I'm checking in the mouth, I can also look at capillary refill time, which will indicate circulation and hydration. Ideally, you want the capillaries to refill in 1 to 2 seconds. So we test this by, again, moving horse's lip out of the way. And then you want to press for a moment. It'll turn white and then refill. I took a little longer to do that just because I was trying to get her lip out of the way. So if it takes a little longer than 1 to 2 seconds to turn pink again, that's a sign that your horse may be having trouble with hydration. She may be dehydrated or her circulation may not be functioning properly. That's one of the things that you can also test when a horse is colicky to see if they're properly hydrated. Next, I'm going to find the pulse on my horse. This can be taken 3 different places: at the maxillary artery, here under the jaw, or at the back of the knee, which is the radial artery, over here. And then there's the digital pulse, which can be felt either on the back of the fetlock or on the bulbs of the heel. Now, in normal circumstances, you may not be able to feel your digital pulse. Usually, if we do feel it, it's an indication there may be some sort of lameness. And we don't measure it for how many beats per minute, we measure it for how much do we feel. And it's important to keep in mind that a throbbing or bounding digital pulse is not a good thing. Now, like I said, normally we will take the pulse at the maxillary artery. A normal range for your average horse is 32 to 44 beats per minute. Now, of course, as with all the other vital signs, you need to know what is normal for your horse. It could be that your horse runs more at 30 beats per minute as opposed to 32. It's just important to know what's normal for your horse. Now, we take this by finding the pulse in the maxillary artery, which you can feel with your fingers, and then having somebody count, or rather, excuse me, measure a certain amount of time while you count how many pulses you feel. Now, you can do either 10 seconds, count for 10 seconds, and multiply by 6, or count for 15 seconds and multiply by 4. I'm going to have Jane here time for 10 seconds. So first, I want to make sure that I can find her pulse. I found it. Ready? Go. Time. All right. So I had her measure for 10 seconds. I counted 6 to 7. So multiply by 6 and you get 36 beats per minute, which is well within our range of normal. Now, things that could change what is considered normal may be exercise, stress, pain, illness, and it's important to know what's normal for your horse and what may be factors that could increase a heart rate. Now, of course, with pulse and heart rate, if they're elevated, that can mean anything from pain, colic. It can be simple exercise. They've been working and so their heart rate is up. It can be affected by the weather if they're too hot and they're trying to cool themselves off. So it's important to realize that, as with all of our vital signs, you want to take multiple vitals to make sure that they're all telling you the same thing. The next thing that I'm going to check is hydration through the skin pinch test. Now, this can be done on a horse's neck, right about here in the triangle area, or on their eyelid. Obviously, we don't like to use eyelids. Now, I perform this test simply by grabbing a little bit of skin, pinching, and watching to see if it goes flat. Skin pinch test. It should go flat in about 1 to 2 seconds, just the same as a capillary refill time. Now, things that could affect this is dehydration. If there's not enough moisture going through the horse's body, it may take the skin a little bit longer to flatten again. And then also age can affect this. Older horses are going to have skin that's not as pliable as it was when they were younger, and then the skin may remain tented for a little bit longer. Now, next thing I'm going to test is for the heart rate. Now, the heart rate and the pulse are very similar. You're testing to see how fast your heart is beating. The only difference is here I'm listening for the heart itself, whereas here I'm listening, or rather feeling, for the blood moving through the arteries. So to do this, I'm going to need my stethoscope, and I'm going to listen for the heart right here around the heart girth area. Now, this is one of the harder vital signs to test for, just because each horse has heart in a different spot, and it's a little hard to find. However, with the stethoscope, obviously it'll be much easier to hear, and it should be about the same as the pulse, so 32 to 44 beats per minute. So just like with the pulse, I'm going to have Jane here time for me. I'm going to have her time for 10 seconds, so whatever I count, I'll multiply by 6, as opposed to if she timed for 15 seconds, I'd multiply by 4. So, put my stethoscope in, and then I'm going to want to make sure my horse knows what's happening. All right. Go. Time. All right. So I got 6, just like when I did my pulse. Multiply by 6, and I get 36 beats per minute. It's good that these match up, as they should. Now next, I am going to check my respiratory rate. The average normal respiratory rate is 8 to 16 breaths per minute. Now, of course, you need to find out what's normal for your horse. And this can be affected by, again, heat, exercise, anything, any kind of illness, especially pain, similar things that can make heart rate go up, as with respiratory rate. Your respiratory rate should always be lower than your heart rate. If they switch and your respiratory rate is higher than your heart rate, that's called an inverted rate, and that is very, very bad and needs to be taken care of immediately. So to take the respiratory rate, I'm going to stand at the front of the horse and look back at her flank and her belly, and I'm going to watch for her to inhale. And Jane is going to time me. You can do 10 or 15 seconds as you would with the pulse and heart rate. I like to do a little bit longer, just because it takes so long for them to take a breath that it makes me a little more comfortable to time them for longer. And she's good about holding still, so I feel more comfortable taking a longer time. So I'm going to watch her flank for 20 seconds. So I'll multiply by 3 when I'm done, whatever I count. Wolmere. All right.
Ready?
Yep.
Start. Time.
All right. So I got 4 breaths in the 20 seconds, so I'm going to multiply by 3, which gives me 12 breaths in 1 minute, and that is comfortably within our range. And so for her, I am pretty confident that she's doing just fine. The next thing that I'm going to check for is gut sounds. Now, there are 4 quadrants to the gut, both sides divided into top and bottom. And it's important to listen to gut sounds, especially for symptoms of colic. You want to make sure that you can always hear noise in each quadrant, and it should be kind of a gurgle, some sort of sounds that something's going on in there. If it sounds like running water, that may be a sign of a hypermodal gut, meaning everything is going too fast and it's not being properly digested. You want to make sure that there aren't any, or rather that you do hear things. Otherwise, if there are no sounds, it could mean that there's some sort of impaction or obstruction going on. You want to make sure there's no pinging. That is also an abnormal sound. And keep in mind that there should always be sounds, because your horse should be grazing, it should be constantly digesting as they would in the wild. So your horse's digestive system should always be about 2/3 full. So I'm going to start by listening in this upper quadrant. And I hear some gurgles there. Make sure you have your hand. And I got some good gurgles there. And keep in mind that as food passes through the gut, it may take a moment for you to actually hear anything. So if you don't hear anything right away, it's no reason to panic. Now I'm going to walk around to the other side. And then I'm going to check here. And I hear some gurgles. That's good. And I hear some nice gurgles right there. Ooh, that's a long one. Alright, so I've heard some nice normal sounding movement in all of her quadrants. So in this case, I'm not too worried that anything's happening other than what should be. The final vital sign I'm going to check is the temperature. Now, we do a horse's temperature rectally. The normal range is 99.5 to 101.5 degrees Fahrenheit, with the average being 100.4 degrees. Now, as with all of our other vital signs, it's important to know what's normal for your horse, whether she runs a little high or a little bit low. I'm going to take her temperature with a digital thermometer first. You want to make sure that you lubricate the thermometer. Never stick any of your thermometers in your petroleum jelly, which is what we're using for lube, because it's a way to pass on bacteria from horse to horse. And of course you can use petroleum jelly, you can use KY jelly, spit if you're in a tight spot and don't have anything else. Turn it on, make sure that it is functioning. Then I'm going to stand to the side, lift her tail, and insert. I want to make sure that I'm pressing against the rectal wall so that I'm not getting any poop. I don't want the temperature of the poop. It has read the temperature perfectly quickly, and I got 99.3 degrees Fahrenheit. So that's pretty normal. It's a little bit low for our range. However, digital thermometers tend to read about a degree low. So with a mercury, this would probably read about 100.3, which is, of course, right in where we want our average to be. Now, my digital thermometer, I cleaned off with a towel, put that away. Now I'm going to use my mercury thermometer. So mercury thermometer is glass, has mercury in it. So you actually have to leave the thermometer in a little bit longer and wait for the mercury to rise with the temperature. So it's important that before I insert the thermometer, I shake it down. So you gotta make sure the mercury actually goes to the one end of the thermometer. You wanna make sure you're actually shaking it with some force. And once I'm pretty confident that it's shaken down, which it is, I'm going to put my petroleum jelly on it, just like I did with my digital. And as for which thermometer to use, you can really use whichever one you're more comfortable with. A lot of people prefer the digital. I don't have a particular preference. Now, because this mercury has to actually rise, I need to make sure that it's in there for a certain length of time, which is 2 minutes. So Jane is going to time 2 minutes for me. Now, because I have to leave this thermometer in for 2 minutes, I have a little binder clip that I will attach to her tail so that I can actually let go and not worry about the thermometer getting lost in her rectum. I'm actually going to keep holding the thermometer just because I like to know where it's placed and have it not move around. But I could let go if I wanted to. Now, with a high temperature, that could be fever, based off pain. She could have a higher temperature if she's been working recently. So as with all our vital signs, you really need to compare all of them to see what signs, what symptoms you may have. Okay. So now that 2 minutes is over, I'm going to lift her tail, remove the thermometer, and unclip it. I'm going to wipe my thermometer off so that I can see it better and get any poop off of it. And now I'm going to try to read the temperature. And I'm getting 100.1. About 100.1, which is approximately 1 degree higher than the digital thermometer, which falls right into our normal range and tells us she has a normal temperature. And those are our vital signs. Thank you for joining us.